Good morning, Rotarians. David Spivey has our prayer pledge and four-way test this morning.
If you please join me in prayer. Dear Heavenly Father, we just praise your name for who you are, what you mean, what you do. Forgive us when we've not looked to you for guidance. Thank you for taking us back whenever we do stray and look away. Help us to have the courage to follow you, the courage to have faith, the courage to look to you for guidance in our actions. Bless this food, strengthen us so that we can serve. In Jesus' name, amen. Please face the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And the four-way test of the things we think, say, and do. First,
is it the truth?
Second,
is it fair to all concerned?
Third,
will it build goodwill and better friendships?
And fourth,
will it be beneficial to all concerned?
Thank you.
Thank you, guys. Okay, we're going to get right to our program this morning, and I will bring up Sandra Gaskins, who is actually a fellow Rotarian. She's a member of the Hendersonville Breakfast Club, and I'm going to let her introduce our speaker.
Good morning, everybody. Thank you so much for having us. And my glasses are in my pocket, so hang on just a second. As Rotarians, we all know that ending polio has been a cause Rotary International has championed since 1978. But it's not our only cause. Included in the list of 9 on the Rotary.org website is saving mothers and children. So I can think of no better group as a Rotarian than Rotaries across Tennessee to bring this presentation on the maternal healthcare crisis in Tennessee. The topic is not a small one, and this presentation is only the tip of the iceberg. Dr. Katrina Green is on the forefront of fighting this crisis. For this discussion, she represents herself and not the hospital she works for. Dr. Green is an emergency room physician, originally from Michigan. She's called Tennessee home for the last 14 years. She earned her medical degree at Wayne State University in Detroit and completed her residency training in emergency medicine at Indiana University in Indianapolis. She has worked in hospitals all over Middle Tennessee, including Nashville, Clarksville, Columbia, and Lawrenceburg, giving her insight into healthcare in both urban and rural areas. She is on the board of directors for the American Medical Women's Association and is its advocacy committee chair. She spends her free time advocating for healthcare policy at the state legislature and educating the community about healthcare related issues. Please help me welcome Dr. Green.
Thank you, Sandra, and thank you again all for having me. I just want to give you a full disclosure here. I usually work the night shift, so I usually see this time of day coming from the other side. So I'm a little sleepy this morning, but we'll get through it together. As Sandra said, we're going to talk about the maternal health crisis here in Tennessee. But I wanted to start off and say that it's not a crisis for our country alone. This is a worldwide crisis. Somewhere in the world, a woman dies every 2 minutes because of pregnancy-related causes. So we've got about 20 minutes for this talk. By the end of this talk, about 10 women will have died. 20 women. I can't do math again. Not my time of morning. But what exactly is maternal mortality? What are we talking about? How do we define it? It's the death of a woman during pregnancy, childbirth, or the 6 weeks postpartum. This is a graph that shows how bad the crisis is, comparing us to other countries, our peer countries. Stand out the way here. So it gets a lot worse as you go from left to right, and the U.S. is the worst over here. So our peer countries actually had the opportunity to visit 2 of them this past December and in January. I went to Australia and New Zealand, and interestingly enough, things that these countries have in common that we don't have is socialized healthcare and easy access to it. But we also separate out maternal mortality in the U.S. with the different races, and you can see that it is
Oh, there it is.
I touched the cord. So much higher for Black women in particular. This is a graph that shows our maternal mortality over time here in the U.S. Compared to our peer countries on the bottom. As you can see, we are starkly higher. What happened in 2020 that made our rates go up? Well, COVID happened. And women who are pregnant are a lot higher risk for getting severely ill from COVID. But fortunately, we saw rates start to come down in 2021 as a result of us having access to vaccines. We still have a lot of work to do, though. Now, dialing it down to Tennessee in particular, these are just some headlines from the news over the last year that show how bad this is. From the March of Dimes, that is the report where we glean a lot of this data from, Tennessee has ranked at the very bottom for maternal mortality 2 years in a row. Our rate is 42.1 deaths per 100,000, which is how they measure this. That is twice as high as the national average. 221 women died between 2018 and 2023, which doesn't sound like a large number, but if you think about this, these are people who had families, who have birthed a child who is now motherless. And just to give you an example, I presided over one of those deaths earlier on in my career. We had a woman who was about 2 weeks postpartum come in by ambulance in cardiac arrest. And despite all our best efforts, we were not able to resuscitate her, and she died in my emergency department. And I will never forget the screams of her mother and her sister who were there in the room for that. And I always wonder what happened to that woman's baby. You know, is that child doing okay without a mother? And the thing that breaks my heart the most is that 90% of these deaths are preventable. When our own state Department of Health looks at these deaths, there is something that could have been done upstream to keep these women alive. But here's another graph that shows our maternal mortality in Tennessee compared to the rest of the U.S. As you can see, we're much higher. Good news is we're getting better, but we still have a lot of work to do. What is causing women to die here in Tennessee? Well, the number one cause, unfortunately, is mental health conditions. And I can tell you firsthand, it is incredibly hard to get someone treatment for mental health issues in my emergency department, which is often the only place people have to go, especially when they don't have access because of lack of insurance or, there's just nowhere to turn when you're in a crisis. I've had people wait in my emergency department for 7 days to get placed at the Middle Tennessee Mental Health Institute, which is really our only place that we have to send uninsured patients. It's even harder to get a pregnant woman care for mental health because a lot of mental health institutions don't want to take pregnant women because they're scared of treating someone who is pregnant. That was very touchy. That also includes substance use disorder. We saw, the opiate crisis hit Tennessee just as hard as it did other states, and that didn't spare pregnant women. Cardiovascular concerns come in second, so that's anything heart-related, including preeclampsia and eclampsia. Infections, COVID-19 killed a lot of pregnant women, and then hemorrhage, embolism, and then there's just a big overall lumped in there of other causes. If any of you want to scan this QR code here, that takes you to the report from the State Department of Health where we get all this data. And I can flash that back up at the end too. Now, other factors that play a role, people don't have access to prenatal care in the way that they should. I mean, that's close to 20% of women are not getting adequate prenatal care in Tennessee. Only 73.2% of Tennessee mothers get care in their first trimester. Again, we rank 45th in mental health care access. When mental health causes are the leading one cause of death, we need to work on access to mental health care for these women. And unfortunately, a quarter of those deaths are due to suicide. Discrimination plays a big role. About a third of pregnancy-related deaths here in Tennessee have some form of discrimination causing those deaths. And that leads to Black women dying 3 times higher rates. Most of these pregnancy-related deaths happen after the delivery. So that means that postnatal care is incredibly important, which makes me very glad to say that, the Tennessee Department of Health has extended TennCare coverage because you qualify for TennCare or our state's Medicaid program when you're pregnant. They have extended that coverage out for 1 year after delivery, which is great. Another thing that plays a role are maternity care deserts. So that's any county without a hospital or a birthing center and no OB clinicians to deliver said babies, which a third of Tennessee counties qualify for that. And this was back when the report came out last year. Since this report has been released, we have two hospitals who have announced they're closing their labor and delivery units. So you might have heard about Pulaski announced back in December, and Sweetwater announced in January that they were closing their labor and delivery units. So it's probably even greater now. So 34 of 95. I have to look into how many, because Sweetwater served 2 counties. So I don't know if both of those counties are now deserts or just one of them. I do know Pulaski now needs to be added. So it's 35, maybe 36 counties. A quarter of Tennessee women have 30 minutes or more to drive when they want to deliver. And then the lack of prenatal care because of living in a maternity care desert means you're 5 times higher likely to die of pregnancy-related causes. Right now, there are 9 Tennessee hospitals that are at risk of closing, and I can show you those hospitals afterwards if you want that where those are. Again, these are just the headlines that we saw, those 2 hospitals announcing they were closing their labor and delivery units. This is a map that shows where those deserts are. I don't have a laser pointer, but let's see. We are in Rutherford County here, right? So you guys are lucky. You've got at least 2 hospitals where folks can give birth. We are very blessed in Davidson to have several, but you have how many counties touching you that folks don't have care? So they're coming into your county to access health care and give birth in your hospitals, and potentially leading to increased wait times for women here in Rutherford County. Here's another graph that just depicts the mortality rate by the regions. And I thought this was a really interesting way to compare the past graph to this one, because a lot of folks assume that Shelby County is the worst, and it's not. It's Madison. But why is that? If you go back to this one, every single county surrounding Madison does not have a birthing center. So all of those women are driving into that county to deliver, and many of them have not had any prenatal care. So that leads to that county having the worst health outcomes. What is the state of Tennessee doing to prevent these deaths? Well, a couple things are happening on the legislative side. House Bill 572 passed, I believe it was either last session or 2 sessions ago, requiring hospitals to post signs like this in their hospitals and their clinics and their labor and delivery units, and hand these flyers to patients. And I believe they're available in Spanish as well, that tell them what to look out for. Since we know the majority of the deaths are happening after birth, we want to tell folks when you're pregnant, postpartum, these are things that you need to talk to your doctor about or get to the nearest hospital. So education. We're also doing more testing and screening for infectious diseases during pregnancy. That was another bill that came out of our state legislature. This one I've highlighted in red because it hasn't passed yet, but would appreciate any help y'all can give in convincing legislators to cover this. Doulas are a healthcare professional that specifically supports the mother during the birthing process and postpartum recovery period. And they're just a trained advocate that knows the warning signs and is there to be there for the mother. Sometimes the mother doesn't have anyone to advocate for them. And childbirth is a scary thing. I've never been pregnant myself, but I've been present for the birth of my nephew and my godson. And both of my sister and my best friend were terrified that something was going wrong. And it was great for them to each have me in the room and present for them, not even a trained doula. But doulas do statistically decrease the likelihood of death. So if we could get TennCare to cover those services, a lot more women would have access to them, and we can save lives. So it stalled out in the last session. I haven't seen it put on the calendar for any committees yet this session, but I'm really hopeful that will start to move soon. if you want to call your state legislator and tell them to support this bill, that would be very helpful. There's also the Tennessee Maternal Health Strategic Plan. I don't want to get into the weeds on this one too much, but you can scan the QR code and read all about what our state health department is doing behind the scenes, all the different programs that they're activating right now, and how the Maternal Mortality Review Committee is looking into these deaths and what can be done to fix it. All right. So as hard as that was, talking about women dying, we're going to make things even more uncomfortable. And I'm sorry, it's really early to go into this stuff, but we have to say these things. Women that live in states with abortion bans are more likely to die of pregnancy-related causes. And we are in one of those states. The Human Life Protection Act was our abortion trigger ban that passed back in 2019 before Roe fell. And as soon as Roe fell, it became active, I believe, a couple months later. So as of August of 2022, Tennessee has one of the strictest abortion bans in the country. Now, at the time, it was a complete ban without any real exceptions. And so myself as an emergency physician was terrified that I was going to have to commit medical malpractice or potentially go to jail for treating something called an ectopic pregnancy, which we'll get into later, because that wasn't carved out as an exception. Now, thankfully, our state legislature has, rightfully made some exceptions to the bill or to the ban. And so now we can treat ectopics and we can treat molar pregnancies. But for all other abortions, it's a Class C felony. So myself or my colleagues could go to jail or prison for 3 to 15 years for treating things like incest, rape, minors who become pregnant, and lethal fetal anomalies. So pregnancies that will most likely not make it to term or live very long after birth. There are no exceptions for that. Also for mental health conditions, which we know women are dying of, and other confounding medical conditions. So trying to understand the laws, it's really difficult to keep up with this changing legal landscape as a physician. No one sends us out an email from the state when they update the laws to allow for more exceptions, or when they repeal laws. We don't get a notification in the mail or via email. So we have to keep up with this on our own. And we're busy in our practices. Most doctors are not paying attention to what's happening on the state legislature level. So what's going on there, it's hard to keep up. Like I said, there's 2 different exceptions bills that passed, but then there are several bills that failed. The lethal fetal anomaly bill failed last year, and the rape and incest bill failed. A bill to allow us to treat minors under 13, which the age of consent here in Tennessee, I think, is incredibly low, but it's apparently 13. Anyone under 13 has been pregnant due to rape. So we can't treat that. Here's a map with all the states with abortion bans and restrictions, and states that do have exceptions for fetal anomalies. You can see the states that are in dark red have exceptions, and we are a state that does not. So what are the effects of these laws on our patients? Well, it can lead to delays in treatment for pregnant emergencies. Before there was an exception for ectopics, there was a story that came out in the news of a woman that was in the emergency department at Vanderbilt for hours waiting for the doctors to communicate with the administrators and the legal team to see if they would go to jail to treat her, or if they were going to all agree that it was the best thing to do. Meanwhile, she was hemorrhaging internally, nearly bleeding to death. Luckily, she survived. I don't know if her fertility did, though, because they then had to remove her tube and maybe an ovary as well. Difficulty obtaining medication for other conditions. Like, this is something that doesn't come up on the radar too much, but there are women who've come forward who've said, I can't get my medicine from the pharmacy for my lupus and my rheumatoid arthritis because methotrexate is an abortifacient and the pharmacist doesn't want to give that out to patients anymore. Delays in cancer treatment. Some women who are diagnosed with cancer don't know they're pregnant until they go through that screening, and then there's a choice between delaying your cancer treatment for 9 months or getting an abortion so that you can undergo chemotherapy. If they choose the latter, they have to go out of state. And that's a hard decision, but that's a decision that is really made even more tough by our laws. The continuation of non-viable pregnancies. And that one I think is really hard for a lot of folks. It's a very tough decision what to do when you're faced with a non-viable or a lethal fetal anomaly. So you go through your 20-week anatomy scan and something is wrong, and you're told by the doctor this baby is not going to make it outside the womb. Some families would want to terminate the pregnancy, not have to go forward with it. Some families will want to continue and do comfort measures at the end when they deliver. And that's fine, whatever they choose. But right now, that first option is not an option for folks in Tennessee. So they are having to go out of state, pay a lot of money, and go through a process that's made even harder. There's fewer specialists to treat complications because a lot of my colleagues have decided that this is not a state they want to practice medicine in. And so we've had maternal fetal medicine doctors, the doctors that help diagnose those fatal anomalies and treat these high-risk pregnancies. They're going to other states that are more favorable for them to practice in. So that means there's fewer doctors to treat those complications when they arise here. Other unintended consequences, there's increases in babies born with significant health defects because they're being forced into this world, and sometimes those families would have chosen differently. So there are hospitals that are expanding their NICUs. There are babies that are basically being born to die. Some of them only make it a few days, some of them a few weeks, some of them are going to linger in an ICU for longer than that and incur an incredible expense and heartbreak on that poor family. Our maternal mortality rates are worsening, and our infant mortality rates are going up as well, because those infants, babies, pregnancies wouldn't have been carried to term in the prior situation. Now they're being born, and our rates are going up. We've gone from 36 in the country to 38 year to year in our infant mortality rates. We're seeing declining birth rates. So women in Tennessee are scared to get pregnant because they don't know if they're going to get the treatment they need. So more people are looking to permanent sterilization. The OBs that I know and work with, they're doing more tubal ligations. The urologists are doing more vasectomies. People are looking for ways to not become pregnant in Tennessee. People are afraid that they're not going to get care. They're afraid of bad outcomes. And folks that are able to access abortion care out of state, that's happening later in pregnancies than it would otherwise, because it's taking them time to arrange things like travel, the expenses, childcare for the children that they already have. And then we're going to see increased poverty and crime rates over time as more babies are born to women that just don't have the financial means to take care of them. And I don't know if you all have seen the DCS in the news lately, but we don't even have anywhere for the children in our foster care system to sleep right now. They're in offices, and apparently they're going to be put in juvenile detention facilities. Other effects of our laws on healthcare, doctors are just retiring early. A lot of my colleagues are just throwing in the towel and saying, I can't take it anymore. I've put in enough time and I've got enough money, and I just am not going to do it. So gone, I think, are the days where you're seeing doctors practicing medicine into their 80s. I think people are like, I'm in my 60s now and I'm just done. Like I said, OBGYNs are leaving the state to go to states where it's easier for them to practice. We're having difficulty recruiting medical students and residents to come here to train. There's been a 20% drop in applications to our residency programs for OB specifically. For other things, I don't know all the data on that, but I know that medical students and residents who happen to be female, they're in their prime childbearing years, and maybe they're afraid to come here and be pregnant in a state where it's not, where it's scary to be pregnant. And then it's just harder to recruit doctors to work here in general. So you're going to see where you have fewer primary care doctors, fewer surgeons, fewer gastroenterologists, because we're all people too. And we just want to live our lives and do our jobs. But we look at the healthcare situation in the states that we're moving to as well. Just like back during the tort reform days, doctors flocked to states where they were less likely to get sued. we're less likely to go to states now that have restrictive laws. And that leads to fewer doctors in all specialties. So it's going to affect all of y'all's healthcare in this room when you can't find a doctor. And then here's just some headlines and showing, that this is out there in the news too, that there are decreased doctors and residencies, slots being filled. Rural Tennessee is bleeding independent physicians. Part of that is the laws here. Part of it is we didn't expand Medicaid and our rural hospitals are shutting down. I want to touch on spontaneous abortion. So for those of you who aren't aware, that is the medical term for miscarriage. So an abortion happens spontaneously in 1 in every 4 to 5 pregnancies. So everyone in this room knows someone who's had a miscarriage or spontaneous abortion. But our laws are leading to delays in treatment for this as well, because doctors want to not violate the law. We don't want to go to prison. We don't want to pay a fine. We don't want to be that first person who's arrested under this abortion ban. So folks are getting, instead of just one ultrasound showing there's not a heartbeat, they're bringing back that patient for a second ultrasound showing there's not a heartbeat, to be ultra extra sure before they agree to do a DNC procedure, which is evacuates the uterus. It's a medical abortion, or giving someone the pills that would do the same thing. So, and then it makes it more difficult to obtain the medications, the mifepristone that you've probably heard in the news. That is the pill that we use to help complete a spontaneous abortion that hasn't completed itself naturally. Well, some hospitals don't carry that medicine anymore, and some pharmacies won't dispense it. This was a story that was in the Oak Ridge news recently, that a woman came forward and said that the abortion ban made her carry a dead fetus in her body for 4 weeks before she could get treatment. So these are real people that this is affecting. These are real stories. What can we do about this? Well, we need to improve healthcare access for one. We need to make sure that every woman is healthy before she gets pregnant. And one thing that would help that would be expanding Medicaid. We're one of the 10 states left that hasn't done it yet. States that have expanded Medicaid have lower maternal mortality rates. They actually have 50% lower infant mortality rates as well. So we need to make sure people can access the healthcare system. We really need exceptions for all of these things, especially the fetal anomalies. I just think it is torture to force someone to remain pregnant with a baby that's not going to make it, when they're not going to bring that baby home. Paid family and sick leave, making sure that women are able to, get off work when they're sick, especially when it's related to their pregnancy or in the postpartum period. I'm blanking on the word, postpartum depression. I mean, people need time to recover. Pregnancy is a risky business, and it is really hard to go through. And there's so many hormonal changes. And when mental health and suicide is killing our women, giving them some time off after they deliver it just makes sense. And then just letting us practice evidence-based medicine. Let us take care of our patients. Let us do what we took our oaths to do. And lastly, what can you all do? Talk with your legislators. We need help to fix this problem. And part of it is going to come from the legislature. Part of it's going to come from people like you advocating to fix this. Talk to your doctor. They can tell you about what they're seeing. They can tell you how to help in the community and tell you all about how hard it is to practice medicine. And then educate others about this. The data that we're getting from this is from the March of Dimes. It's from our State Department of Health. It needs to get out there. People need to know how bad this is so that we can all rally together, come together as a community and fix it. And then please vote. And that was all I have. Now I think we've got some time for questions. We covered a lot, so yes.
Why do you think so many hospitals have closed in Tennessee? The rural hospitals especially?
So it basically boils down to money. We didn't expand Medicaid, as I mentioned, and so there's a really large percentage of our population, over 10%. I think it's something like 600,000 Tennesseans that have no insurance whatsoever. And when they present to the emergency department, there's a federal law called EMTALA, which mandates that we treat them. And we do. We treat everyone who comes to the emergency department. That's why I love my job, because I don't care if you have insurance or not. We treat and see everything. But the hospital needs to recoup that cost. You know, it costs money to have doctors on staff 24/7, to have nurses on staff 24/7, to have the CAT scan machine and someone to operate it on call 24/7, right? To have surgeons on call to run their operating rooms, and anesthesiologists to put you to sleep because you don't want to be awake during your surgery, right? So all of these things cost money. And when you have an uninsured patient, they may not be able to pay those bills, or they pay a little bit, but doesn't cover the cost. So the hospital eats the cost of that uncompensated care. And rural hospitals, unfortunately, bear the burden of the majority of our uncompensated care here in Tennessee, and really in the entire U.S. It's not just a Tennessee problem, our rural hospitals closing. It's everywhere. We just happen to be the state that led the U.S. in rural hospital closures per capita because of what happened when we didn't expand Medicaid. So I'm not an economist, but I know some money is better than no money. And having patients have access to insurance and getting hospitals some compensation for the care they provide is going to keep the doors open longer for the hospitals we have left. I hope that answered your question.
Yes, thank you.
So before the abortion ban went into place, what number of abortions were being practiced or being done in the years previous to that?
I don't have that answer.
Concerning maternal mortality, are there any statistics comparing married versus single women?
Not that we've
Not that I've seen, but that data might be out there. I just don't have that. But I can only imagine that being in a married couple, you would have extra support to get you through that. So one could venture a guess that maternal mortality is higher for single women. But again, I don't have that data. Any other questions?
The position at the beginning, it showed the Hispanic population, because it's divided into three. We always divide ourselves into groups. Well, they were actually the best over your slide says U.S. white, U.S. black. Why? That's interesting. I mean, what are the Hispanic population doing better than other populations?
Yeah.
Especially if you think most Hispanic population are maybe not on the highest economic scale, relatively speaking. I mean, that's the impression we all always get.
Right. I would just be venturing a guess on this as well, because I'm not someone who studies this. But if you think about the Hispanic population culturally, there's a much more tight-knit community and more multi-generational families living together. So I think there's a better support network for those pregnant people. But again, that's just my best educated guess as to why that is.
Yeah, that's kind of we have different groups come in and talk to us about from the United Way, the ALICE population, to get after this population, if you get it through other agencies, if that makes sense. I forget what ALICE, but just the group of people who are just barely making it. One major crisis now could become homeless, so or housing. But anyway, there's so many different ways to look at this problem, and so I would just assume what you said. That's the one thing I would know. But it's interesting when you look at the problems through different lenses. Maybe it's not it is a healthcare problem. I agree 100%. But maybe it's a family problem. It's a community problem. It's other agencies that are do healthcare that actually help solve this problem. If that makes sense.
Yeah. I mean, there's multiple solutions.
Care, I thought if you're like a single mother with no job, TennCare paid for your health care before, and then the birth, and then the post care.
It doesn't. So you only qualify for TennCare once you become pregnant.
Yeah, that's what I'm saying.
So there's no care prior to, and so there's a lot of folks that have chronic medical conditions like high blood pressure, diabetes, other ways that we can optimize health before pregnancy, educating folks about quitting smoking, healthy weight, healthy habits, things like that, that make women go into pregnancy a lot healthier. Unfortunately, we're not able to do that part right now.
Yeah.
So, but as soon as you become pregnant in Tennessee, yes, you qualify for TennCare, but there is a delay, right? It takes time for that paperwork to go through. And I mean, I've never applied for TennCare. I don't know how easy it is to do that, but maybe that's something we need to do.
Well, I knew
It
somebody
takes
who did that,
time.
And so, I mean, yeah, once they get pregnant, they got TennCare, they had their 4 or 6 week medical checks that every person goes through. Their child had a feeding issue. TennCare paid for that. Once the baby was born. I think maybe it just depends on what part of the state you're in.
Yeah.
But I mean, it does pay, which is amazing. And even post birth.
Yeah.
One thing we do know is that lots and lots of doctors do not accept TennCare. So you have to search and find for the doctor in the facility that will treat you under TennCare. That's the other issue that they're facing right now.
Yeah, I
So
understand.
I think there's we have another doctor, Dr. Nicole Schlechter, at St. Thomas Ascension, and isn't that the only hospital that accepts TennCare?
Oh, we accept TennCare
Okay.
at my
okay.
hospital. I think she's talking about the clinic that she works with a midwife clinic. And the midwife clinic is one of the few clinics in town that is outpatients will see TennCare patients. And that is another thing we can advocate for is reimbursing for TennCare covered, like reimbursing the providers more when they provide care to a TennCare patient to make it more attractive for doctors and other providers to treat TennCare patients. But that costs money. So at the end of the day, we need to decide as a society, as a state, how much is a human life worth?
I just had one question and a statement. My daughter wanted to be an OB, did a rotation, and then she heard about all the laws. Her and her other girlfriend. When Nikki's in Emory, and she's doing it now, a residency in OB, Samantha decided to spin out and do family medicine because she was afraid that she would violate the law. The second question, the real question I have for you is, when we're going through our pregnancy, there's this test we have to take. Is it called the alpha-fetoprotein test? It's like when you drink something and then they test you, they can tell whether the baby has major defects like Down syndrome or,
Yes.
because on your list, I didn't see that as a reason to have an abortion. I saw like if the baby's gonna die, but if the baby has genetic defects they can identify and can live, but you won't have that choice anymore, correct?
Correct.
So is that something that you all are considering to put on there? Because in the state of Tennessee, especially in special kids, there are a lot of people that may have made a different decision, but now they're gonna be forced to have their babies. And there are not a lot of special kids nursery and therapy centers here. There's not a lot of resources for that.
Yeah, I think we kind of lump that under that lethal fetal anomaly, which
Okay.
maybe that one's not as lethal, but yeah, there fetal anomalies in general, there's no exception for. And right now there's a bill, Representative Watson has a bill that would change in vitro fertilization laws here in Tennessee that would make it illegal to screen for genetic diseases, which, you know, I have a doctor friend who him and his wife both carried the cystic fibrosis gene, and they went through in vitro fertilization versus natural pregnancy in order to ensure they did not have a child with that disease. It's not a fatal disease, but it's a horrible condition to live with. In some cases, you need a lung transplant to survive after childhood. So they, you know, went through in vitro. If this law passes, that would take that option away from folks. So, you know, it's not just abortion laws that are passed up there. It's laws regarding all of the reproductive health care. And this is why it's a bad idea for our government to get involved in healthcare when they're not healthcare providers and they don't understand from a firsthand experience as a doctor and a patient how this affects folks in their everyday lives.
Thank you for your visit today. It's really sobering.
Got one more in the back.
Yeah, and you may have shown it on your charts earlier. Before Roe fell, how many abortions were in Tennessee annually? And then can you say how many of those were non-elective or from the examples that you listed?
Again, there was a similar question earlier. I don't know that answer, and I'm sorry. I guess maybe that's something I should look into to have that data for next time.
We don't have access to that data because the majority, the 90% of any abortions throughout the United States were always done within the first trimester. So that's the only one data I can say that I remember for sure.
What percentage does the female themselves have a choice in whether they can do what they need to do with their bodies? What percentage goes into play, even in all of these laws?
Well, they get no choice at Tennessee.
Because I know some states make them carry even a deceased fetus. When the baby's already dead, they have to carry it.
Yeah, so it's hard out there right now. It's hard out there right now.
Both of my daughters are in their 20s. They talked about being sterilized by their doctor. And they talked about leaving Tennessee before they have children. If they have children, they would leave the state of Tennessee and not be here.
I have a daughter, she wants to have a baby and I'm scared to death.
Yeah.
She's
Both
got some
my
fine
children
conditions.
openly told me my grandchildren I have to move to Tennessee. They just want their children here. The education system, healthcare system, they're like,
So
I'm
we
not
have
putting my
this,
kid in Tennessee school, so I'm not putting my kid in Tennessee healthcare. No.
so we have this great 2035 plan for the city to grow. But guess who's gonna be here? If we're not having babies,
No.
There's going to be a decrease in population.
Massive tax basis.
Guess we should add that to the unintended
I don't know, I got a
consequences.
lot of neighbors from California. There's a ton of people moving
yeah, but
to
they're
the city.
retired, aren't they?
No, they're not. They're not retired. They're working hard. They're making a lot more money here than in California. There's a lot of people moving to Tennessee.
It's,
Doesn't change the population of the area.
All right. Thank you.
Thank you all so much.
We can go. Thank you so much. I have a little gift for you. I have a pen that has, it's got the Rotary logo and stuff like that on there. And this is a challenge coin that has our 4-way test that we recited earlier. So
Thank you so much.
Thank you so much. Okay, so since we kind of flipped our agenda this morning, do we have any announcements that we need to talk about?
Barbecue meeting in the morning will be Zoom only.
Zoom only barbecue meeting in the morning. If you still owe money for your foundation football pledge, please give it to Chris. Judy will be back. She's been in Florida this month, but she'll be back. But just
She's back briefly this week. But
Oh,
she's gone again.
she's gone again.
Okay. You gotta check into it.
So give it to Chris. Yes.
Just want to thank everybody for the panel build. So if you participated, thank you very much. We appreciate it.
thank you for leading that.
Awesome. And then don't forget the Good Scout Luncheon is next Wednesday. And if you plan to attend, let David Phillips know. He's in the back there. So other than that, I don't guess we have anything else. So you'll have a great rest of your day. Oh, you have an announcement? No.
You're on baby watch. The second baby.
Oh, awesome. Okay. All right. Well, y'all have a good rest of your day. See you next week.